Awesome. So let's do a hypothetical here. I am someone who has never taken their hearing health seriously. I think I'm having a little bit of a hearing decline. What does the process look like of trying to improve my hearing health when I walk into your office? What's the intake process like? How does it progress? All those things.
Well, I mean, basically, most of the paperwork is already filled out. So when you call and you give us all the demographics when you come in, everything is pre-printed out for you. We make a copy of your insurance cards. We have you sign a few forms. Then we bring you back and we evaluate your hearing. The first thing we do is we want to make sure that you don't have impacted wax in your ears because that can affect the hearing. If you do have impacted wax, then we would refer you to an ear, nose, and throat doctor who can remove the wax professionally. In the state of New Jersey, audiologists are not really allowed to remove wax. So we refer to ear, nose, and throat doctors in the area. Once we do the test, then we go over the results. If they need help with their hearing, we'll demo the technology. We'll talk about the cost, the trial periods, the payment plans and stuff like that. And then usually within 2 weeks, they come back, we fit them with the hearing aids, and then we follow them up for at least 3 follow-up visits after they've been fit with the hearing aids. And then thereafter, we'll see the patients, 3 or 4 times over a year, just to make sure that the hearing aids are doing the job that they're supposed to be doing.
Okay, and you look to say once every 5 years, we're going to look to change the hearing aid into something new?
Yeah, well, that's about the average life of a hearing aid. I mean, we have patients that, if someone's 95, more than likely they're not going to want to make a change and get a new set of hearing aids. But once the hearing aids get to be on the older side, there's usually better technology that's out there that they may want. Like a lot of people, they have to replace batteries now every 5 days. So if you have a rechargeable battery, you don't have to worry about that. So I think the 5 years is about the average, and then people are starting to look around for something that may be better. The general rule of thumb is I would repair the hearing aid once and spend the money. I would never repair the hearing aid twice and spend the money.
And I know you briefly, mentioned new technology. What are some technological advances that are getting you excited in this field to help treat your patients?
Well, I think the biggest breakthrough is artificial intelligence in the hearing aid. The hearing aid is truly a brain that can recognize the different environments that you're in and can make the changes based on the representation of that environment. So the hearing aids have what they call deep neural networking, or 50 million different listening scenarios that it can choose from. So that's one thing that is cool. The second thing is the hearing aids can do other things, like there's a fall prevention detection in the hearing aid. So if your grandfather was wearing hearing aids and he fell, it would send a text message to you letting you know that he fell.
Just from him falling and
Correct.
them changing.
Correct.
That's amazing.
Okay. There are hearing aids now that can translate up to 70 different languages. So if you're in Spain and they're speaking Spanish, it'll convert the Spanish to English. And then when you talk, it'll translate it for them to Spanish.
That's insane. So even as someone with no hearing loss, I could wear this and put it in my ears and it would still translate for me. That's unbelievable.
Correct.
That's unbelievable. That's
Right.
awesome.
Yeah, but you're not going to wear something that expensive just for that purpose.
Yeah,
But
exactly.
so that the hearing aid is really like a wearable, a hearable wearable, where eventually the hearing aid is going to do a lot of other things. It may be able to track your heart rate, your blood pressure, remind you of taking your medications, fall prevention, you name it. It's all going to be incorporated in a hearing aid.
It's almost like those diabetic sensors that you attach to your body and they can do more than your average medical device. What are some, misconceptions about hearing loss? What do people think hearing loss is versus what it actually is? What are some things that can be fixed versus can't be fixed? That kind of thing.
Well, I think that the real question is, do you have permanent hearing loss or not? Meaning that, is it a temporary loss because you have impacted wax? Or is it a permanent loss, and what type of permanent loss it is? I mean, are you a candidate for surgery, or are you a better candidate for a hearing aid? Okay, all those things have to be determined by an audiologist doing the testing. I mean, I have patients that are cochlear implant candidates. They're almost deaf, and a hearing aid is just not going to help them. Unfortunately, some of them are in their mid-90s and they're not a good candidate for an implant, so they're very limited in terms of what they can do and how they can hear.
So there are surgeries, because I would always think that hearing aids would be the only thing that could help heal your hearing, but you're telling me there are surgeries that can help heal your ear.
Correct.
So what do those surgeries look like? That's actually something I did not know.
Well, I mean, first of all, we see a lot of children that have fluid behind their ear, and the fluid just doesn't seem to go away. So we would refer them to an ENT that would put tubes in their ears, and all of a sudden their hearing would return to normal. That's a simple PE tube surgery. Other folks may have a middle ear problem where the little ossicular chain bones are screwed up. And again, you can have surgery like a stapedectomy, and that can completely correct your hearing.
Is that something an audiologist can do, these surgeries?
Now,
Okay.
Now, it would have to be done by an ear, nose, and throat doctor.
Gotcha.
Yeah.
Does an audiologist work with an ear, nose, and throat doctor to help manage care for those people in between?
A lot of ear, nose, and throat doctors employ audiologists to do the testing for them. So they work together. We work with 2 or 3 or 4 ENTs in the area, that we trust. So if we feel like they need additional care, we'll refer them to them.
So there's things an audiologist can do that an ENT can't do, and vice versa.
Yeah, it's a little bit different. The ENT is basically looking at, are there any diseases of the ear, and how can we fix those diseases if they can be fixed at all. So they're focused more on surgery. Okay, audiologists are focused on treatment, rehabilitation, things like that. We do a lot of balance testing. So people that are dizzy, we need to find out what's causing their dizziness. Okay, ENTs don't do that. Audiologists do that. And depending on what they need, they may need physical therapy treatment. They may need to see a neurologist. They may need to see an ophthalmologist, whatever the case is. So audiologists just don't sell hearing aids. There's a lot of other things that they do.
Gotcha. It's almost like an optometrist works on the vision, but an ophthalmologist works on the eye, that kind of relationship. So this is totally separate. I spent my youth as a DJ and in bands, and all that loud noise led to me developing tinnitus. Is tinnitus in any way reversible?
Well, for the most part, if it's coming from the brain, you can't get rid of it, okay? If it's coming from the ear and you have hearing loss, you can possibly get rid of it by wearing a hearing aid that has a tinnitus masker. But there's 1,000 different causes of ringing. I've seen people that grind their teeth. They have TMJ. Once the TMJ is treated, they don't have the ringing anymore. I've seen people that are over-medicated with high blood pressure medication. Once the doctor changes the meds, they don't have the ringing anymore. So you have to find out what is the root cause of the ringing.
And something else I wanted to mention, I mentioned I used to be into bands, went to a lot of concerts, that kind of thing. And I've obviously developed hearing loss and tinnitus, but I find that as my life has become tamer, the hearing loss and the tinnitus have gone away or gotten much more manageable. Is hearing loss reversible?
Well, I mean, once you have permanent loss, you can't reverse it. But we've all gone to a rock concert, and for like a day, our ears are ringing and we can't hear as well. And then the hearing just recovers over time. So you have a temporary shift in the hearing, and then it goes back to baseline. Okay.
Gotcha.
Now, if it doesn't go back to baseline, it's never going to go back.
Thanks again for tuning in to Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we'll see you in the next episode.